Reich, MD, and I'm the medical director and the chief scientist here at the Center for Human Reproduction. And it is my special pleasure to be here today with David Barad, who is the clinical director of our ART, or IVF program here at CHR and the senior scientist at the CHR. And this is a new series we are starting today where we have conversation about a topic which we here at CHR feel is very important and may have not gotten all the necessary attention. And a very good example is a recent paper that was published in the Annals of Internal Medicine, with the first author being Hazel B. Nichols and the senior author Dale P. Sandler. And this paper really revised our thinking over many decades about what pregnancy does in regards to breast cancer risks. Really for decades, it was almost a dogma that women who have had children demonstrate reduced breast cancer risks. And in converse, women who don't have children have increased cancer risk. Apropos, the same thing applies also for ovarian cancer. This study, which involved a large number of investigators and a huge number of patients' data, came to very different conclusions. And this is exactly why it is my real pleasure to have David here with me today, because he's not only excellent reproductive endocrinologist, but he's also an epidemiologist and has deep understanding about the analysis of these kind of population studies. And this kind of understanding is very, very important to really interpret the data of this paper. And that's, David, why I would like you to take over here and maybe give to our listeners a quick summary of what the paper shows, and maybe even more importantly, put it into a certain context.
Yeah. So first of all, the thing to understand is, as Dr. Gleicher said, for many years we've understood that pregnancy is protective against breast cancer. And so what was surprising about this paper is to come up with a different understanding, a different kind of conclusion. To understand this better, this particular paper is a combination of 20 previous studies. Now, these were prospective studies that were designed to try to see what are the factors that contribute to the onset of breast cancer. And they're collected over many years under different settings by different groups. And individually, none of those studies showed a positive effect. But these days, what people do is they take together these separate studies, put them together into one very large population. So in this particular study, there were 9.6 million person years of follow-up. What that means is if you had 10 people followed for 1 year, those would be 10 person years. If you had 20 people followed for 2 years, those would be 40 person years. And so by looking at the number of years that they were following people and the number of people that were followed, they come up with this 9.6 million, more than 9.6 million person years obviously there weren't 9.6 million people in the trial, that just some of them were followed for longer periods of time.
But what this allows is that you then can establish consequences not only at one time point, 25 or 30 years down the road after pregnancy, but you have enough data to establish time points in regular intervals.
Not only that, but these were prospectively followed groups. So that each of these groups, they picked a select population and they followed them consecutively over time with serial observations. So whereas in some studies where you just sample a whole population, maybe ask them, were you ever pregnant? That would be a cross-sectional observation, a slice at a particular time. But in this, they're able to put together the effect of an exposure, namely pregnancy in this case, over a period of time, so they could calculate these person years of exposure, and they could tell us what's your risk a year after a pregnancy, what's your risk 5 years, 10 years, 20 years. In a way that in the past, where we would look at women who were in the primary age group for breast cancer, mostly postmenopausal people, and would retrospectively say, were you ever pregnant? What was the effect there? Now you're able to get that follow-up over the individual years following a pregnancy.
So if I understand you correctly, what that then means is that the new data, which obviously suggests that pregnancy increases risk for breast cancer, at least for a certain time period, does not necessarily contradict the old data, because the old data was based on a long-term follow-up. And this is really the first study that has enough patient volume to tell us what's happening between immediately and 30 years.
So most of the old data, well, some like the Nurses' Health study would be following people over time, but a lot of the older studies would simply be cross-sectional. They're not really follow-up. They're looking at a bunch of people who are 55, 60 years old who have breast cancer and saying, what were you previously exposed to? Did you ever have children? And of course, in that group, women who never had children were found to be at increased risk of breast cancer. In this study, in contrast, you have a bunch of these groups that have been put together to this large group, followed year after year to what happens in their life. Did they have a child? Did they have a disease? And they're looking at that longitudinal effect. So you have a little bit more detail, and you can truly track what the effect of an exposure, in this case pregnancy, is over time. Now, at the end of the day, the increases that they talk about, they say there's this increased risk. They estimate it to be what they call a hazard ratio of 1.8 times. That means if there were no risk, it would just be 1. So this is an 80% increased risk of those people that were exposed, and the estimate could be some variance between 63 and 99% increase, but let's go with 80%. That sounds really scary because it sounds like you're almost 2 times greater risk of getting breast cancer if you're pregnant than not. But this is a relative risk. It's not an absolute risk. So, for instance, the people who are 45 years old, in this case, there were about 620 cases among 100,000 women if they did not have breast cancer. And if they did have, if they did not have a pregnancy, I'm sorry. And if they did have a pregnancy, it increased from 620 to 661 cases per 100,000. So the actual number of people affected at age 45 because of pregnancy per 100,000 was 41. So we're not trying to tell people don't ever get pregnant because you're going to increase your risk of breast cancer. It's not an absolute risk, but it is a relative risk, and that makes it interesting because we want to try to understand what is the mechanism that leads to that relative risk?
That's exactly the point that we want to get to here, because our understanding or our belief that breast cancer protects
That pregnancy protects.
that pregnancy protects from breast cancer risk was really based on the fact that that may also have something to do with lactation and with breastfeeding, etc. We never really thought about a deep underlying physiological explanation where that connection actually could be. And I think it's exactly the time studies that we see here in this paper that allow really for the development of some very interesting hypotheses, because what the study showed is that that risk, as small as it may be, continues increasing after pregnancy for about 4 years.
Yeah. So peaked at about 4.6 years, they said.
Yeah.
And then slowly decreased until about almost 20 years, after the pregnancy.
Which is the usual time
Yeah.
when studies were evaluated.
Yeah.
And only at around 20 years, indeed, then do we see a decline, because those women who were destined or may have genetic predispositions or other predispositions, they got their breast cancers already,
Yeah.
and so the remaining ones have actually lowered
So
risk.
when we did the previous studies, it was on that time period when it appears to be protective.
Okay.
But now you have to remember, the incidence of breast cancer increases with age. And so, although and very few women who are young, say a 30-year-old has a baby, and there may be an increase 5 years after she's had the baby as a relative risk, but a percentage increase in the incidence of breast cancer is going to affect many more people who are 55 than who are 35.
Yeah. So, if I can summarize the first part of our discussion, there indeed is news here in the sense that it seems that pregnancy, at least on a temporary basis, increases the risk of breast cancer.
Not altogether temporary. 20 years.
20 years. Up to 20 years, but with a peak at around 4 to 5 years. And that increase, I think it's fair to say, is very small. So, as you correctly stated, nobody should understand that as don't get pregnant because you will get breast cancer. Nothing like that at all. What it really means, and I think here I would like to come into the second and maybe more important part of our discussion. What this really means is that there are some patients who, for some reason, with pregnancy, develop a high risk of breast cancer. And therefore, what are those reasons? What is the underlying pathophysiology that exposes that small group of women to an increased risk of breast cancer in association with pregnancy?
The first thing that most endocrinologists would go to would be the exposure to hormones.
Estrogen, to be more specific.
Well, except you have to remember, for instance, in the Women's Health Initiative, the group that was in the estrogen-only group didn't see an increase in relative risk, whereas those who were taking estrogen plus progestin did see an increased risk. And interestingly, in earlier studies, there have been similar increased short-term risks after exposure to birth control pills. Some other similar prospectively followed things. So, I mean, you could make an argument that has to do with exposure to actually progesterone or progestins.
Some other people have suggested that may be a certain subgroup of breast cancer patients that already have breast cancer, and that initially small breast cancer is fed by this hormone. It doesn't create new cancer.
That was one of the explanations for the old birth control studies, which are 20 years old now.
Yeah.
But we have some other ideas.
Yeah, and I think that is what makes the study, in our opinion, so interesting, because when one thinks about hormone effects, they're usually relatively short-lived. And here we are seeing a relatively long-term effect, up to 20 years. Does it seem likely that the hormone effect may last for 20 years?
I mean, there are different kinds of hormonal effects. So there's the hormone effect of you give something, endometrium grows, becomes hyperplastic, whatever, some tissue grows under the influence of a steroid. But there are other modulating effects on the genome that changes the way it's methylated, changes the way it's expressed, it's sort of epigenetic, that possibly could have a longer term effect. And I think that's part of the understanding of some of the carcinogenic effects of certain exposures. Even they talk about
even estrogenic exposures in the environment.
Yeah, in the environment, they call those estrogen. What is
epigenetic estrogen effects. Yeah, but
that could also have effects. The same kind of modulation could have effects on other systems.
And I think one very attractive hypothesis that all of this really raises is whether this isn't an effect on the immune system. And the rationale behind that is that we all know that the maternal immune system has to reprogram itself in order to tolerate the pregnancy. In other words, the maternal immune system reprograms itself towards tolerance towards that very rapidly growing fetus. So this is not even comparable to an organ transplant, because there the mass of foreign material remains the same. If you get one kidney, the kidney doesn't grow tenfold, hundredfold, thousandfold after your transplant. Here you have a quote-unquote transplant that grows exponentially and yet is not being rejected by the maternal immune system.
And when we do a transplant, we're giving immunosuppression, which generally suppresses things. But here, you're actually reprogramming the immune system to accept this very different individual growing inside.
And we know that there are some suggestions that what happens during that reprogramming, the induction of so-called tolerance pathways, is something that pregnancy has in common potentially with successful organ transplantation, but also with carcinogenesis and particularly metastatic disease. And we now know from recent studies in oncology that tumors really have various tricky ways of disarming the immune system on top of everything else.
Some of which are borrowed from this.
From?
Let the finger by. The immune system has mechanisms, some of which may be borrowed from the whole maternal embryonic adjustment thing. So
of course.
You see similarities there.
Of course, yes. That is increasingly being recognized, that the microenvironments, for example, in early pregnancy and in organ transplantation and in cancer, have a lot of similarity. So the hypothesis that we here are basically talking about is the idea that the maternal immune system, in going through pregnancy, at least partially disarms itself. Mm-hmm. And that disarmament allows either already existing tumors or even fresh tumors to grow, while with no completely normally functioning immune system, those tumors would be destroyed by the immune system, but yet they do not get destroyed. This is obviously a very interesting concept, if it is what is happening, because that may have significance then for many other tumors. I mean, starting with ovarian cancer, where the same association has been believed to exist now for decades, meaning pregnancy protects against ovarian cancer. So that raises the question whether that is really true. But it would even apply to other tumors possibly. So what this study really suggests is that we need to look at cancer following pregnancy in a much broader way.
Yeah.
All right, so if we can summarize, a very important paper that, for reasons which we here do not understand, has gotten surprisingly little attention in the broad media, but even within the medical community. A paper that may have significant consequences if what we discussed here has indeed relevance. Not a paper that should alarm anybody by any means, because the observed increase in risk is really quite small, but a paper that should excite mostly basic scientists who want to understand how the immune system interplays with pregnancy and also with cancer. David, I thank you very much. It was very interesting. Thank you.